can think themselves ill in lots of different ways, and there's examples of a lady who thought herself blind. There's also an example of somebody who thought themselves into a wheelchair. But one of the sort of the modern illnesses that a lot of people have poo-pooed for the last 10 years, and I think science has gone beyond that now, but was ME, or yuppie flu, or whatever it was called at the time.
Yeah, I mean, it's very difficult to... Nobody knows what causes ME, and nobody knows what causes chronic fatigue syndrome. All that we know for certain is that at the moment there are no consistently abnormal investigations in those illnesses. But the important point is we would all like to know exactly what the cause is. But until we do, what's most important to realise is that people who suffer those sort of illnesses are suffering very significantly, that the fatigue they suffer is extremely real. I think sometimes there's a perception that if a doctor says you don't have a disease or I can't find anything physically wrong with you, that it means people aren't suffering. But the pain that people suffer in illnesses rather like ME, the fatigue that people suffer are every bit as real as if they had some other disease like multiple sclerosis.
Suzanne, time is you are a consultant neurologist, so therefore the brain is your area, it's your specialist area. It is the one major organ in human beings that we know the least about. We haven't even, I think, what, do we know 10-15% of it? So the untapped nature of our brain, what goes on in there, how it operates and how it can affect, and how those effects can manifest in ourselves, we know as much about space as we do about that.
Yeah. I think the problem is, for a long time, people considered the mind and the brain to be two separate organs. And I think we're probably moving away from that now and thinking it as being interconnected. But you're right, a large problem with these sort of disorders is something must be happening in the brain to produce the symptoms. We don't know what that is. If we can't explain it to patients, it's very hard for them to accept.
Suzanne, is it then the case that if people are suffering with an illness and they've had no positive response to routine treatment, should they consider counselling and therapy?
Well, it's
when all the other boxes are ticked?
Yeah, I mean, first of all, they should consider the possibility of stress-related symptoms. You've nothing to lose. If you've tried everything, why not try this?
Why not?
It's not always a matter of therapy. Sometimes it's physiotherapy. It depends what the disability is. But what I would say is that if all physical disease have been ruled out, at the very least consider this in the way you would a physical diagnosis. If only to rule it out, it will do no harm.
Suzanne, it's a fascinating book. It really is. Suzanne O'Sullivan, it's all in your head. True stories of imaginary illness.